Hey guys, Nurse Dearbear here again. So this time we are going to do an intradermal injection medication, and of course every single time we're going to do our 6 rights. We got the right patient, right drug, right time, right dose, right route, and right documentation. Okay? And of course everything that we do, we're all about keeping our hands clean, because keeping clean hands is what keeps our patients that much more safe. Okay? So we're going to sanitize, get that all going. Okay, you guys ready to begin? Let's go. All right, so now we're going to check our medication with our MAR and the orders that the Dr. Jumpy wrote, okay? So if we look at this, we're going to give Mantox 0.1 milliliters intradermal today, and then we're going to have the patient come back, or the report is going to come back to the doctor in 48 hours. So that means this patient, if they're not in the hospital, they're going to have to come back to the hospital 48 hours later to get the test read. If they're in the hospital, you'll just do it 2 days later, okay? So first thing we're going to do is we got that. We're going to check it against the MAR on the computer. Yes, that is correct, 0.1 milliliters. That is correct, okay? So we have our drug right here, and we're going to check it. We're going to make sure it doesn't have any cracks. Doesn't make sure there's no like particulates that are just floating around in there. And then we're just going to roll it. Roll it in our hands just to warm it up, okay? So we've done that. And our supplies that we're going to need for this one, gloves, like always. We got our medication. We got a TB syringe and alcohol wipes, okay? So the first thing we do, this would normally be capped. If it was a single-use vial, it better be capped or it needs to be thrown away, because I don't know if it was used or not as a single-use vial. Now, if it's a multi-dose vial, it needs to have the initials of whoever opened it, the date and time, and also the date that they need to discard it. In this case, is 30 days. So we are going to pretend like this was capped, and this is a single-use, so I'm going to uncap it, and I'm going to open up my alcohol swab, and I'm going to clean the top of it. Okay, now take my syringe, open it up real carefully. All right, so now that we have our syringe, we're going to pull back and forth a couple of times on the plunger. You want to get any extra air out of the syringe if all possible. Okay, so now we got that. We're going to draw back the dose of air. In this case, we're going to do 0.1 milliliters. So we're going to pull that back. Okay. And then we're going to uncap this carefully, and we're going to place the cap lying flat on a clean surface, and that way we'll still be able to do the one-handed scoop technique to recap this needle, because as long as it hasn't gone into a patient, you can't put the needle back on. But anytime it's gone into a patient, don't ever, ever, ever recap a needle. It's just not a good idea. That's how accidents happen. That's how people get poked. Just not a good idea. So don't do it, okay? So with this in my dominant hand, bevel pointed up, I'm going to insert it at a 45-degree angle and then go straight up to the 90. While stabilizing it, I'm going to inject the 0.1 mils of air into it. And then I'm going to bring it upright, and I'm going to pull back, and we can pull back more on this one because we're not mixing any vials this time. So we can pull back more than we need, and then that's a great way to get bubbles out of there. But if you have any bubbles, you can always flick it too. I'm looking. Okay, so now that we've got our 0.1 medication, pull it out straight out, and carefully with our dominant hand, unless you're really, really good with your non-dominant hand, usually I like to always use my dominant hand because that's the one I'm most comfortable with. I'm less shaky with it. It's just the better one you should be using. Some people are ambidextrous and can do both. I cannot. So we're going to use the scoop technique to recap it. Carefully inserting it in. And then once it's up, we can grab it on the side and click it back on safely. Okay? Hey Skip, Nurse Chair Bear again. How are ya? Doing all right? Skip, tell me your last name and birthday for me again, okay?
Skip Rocker, 1172.
Thanks, Skip. So now I see you're allergic to Celebrex, and we're gonna check the meds one more time before I give them to you. Intradermal milliliter or 0.1 milliliters, okay? And we're gonna do that in your left forearm.
Why not my right? You're sitting on my right side.
Well, we don't want to use your right forearm because you have all your tattoos on there, and I don't want to use that side. I want to use your left arm that doesn't have any tattoos on it, okay? So I'm gonna wash my hands. Okay, so we're gonna do this in the left forearm, and I'm just gonna, this is intradermal, so just barely under the skin, and it's gonna make a little tiny wheel, and it's almost gonna look like a little bulb on your skin. Nothing to worry about, but in 48 hours, you're gonna have to come back to the hospital and we're gonna check it, and then we can give the results to the doctor. Because it's gonna take 48 hours for this test to fully go through, okay? So, do you have any questions for me right now, Skip?
Not that I can think of right now.
No? Okay. Let's get going then. Okay, got my gloves on. First thing I'm gonna do is we're gonna clean the area that I'm gonna put this in, okay? With an alcohol wipe. Okay. Now, so I'm gonna insert this at about a 5 to 15 degree angle and then inject the medication, okay? So I'm gonna uncap while being very careful with this one. And I'm gonna place it facing towards my dominant hand so that I can do the scoop technique if I had to. But once this goes into a patient, it goes straight into the sharp spin. That's just the general rule of thumb. Once it goes into a patient, you don't recap a needle. Don't do it, okay? So, we're gonna hold this with our dominant hand, bevel up, and we're gonna hold the skin down with our non-dominant hand. And at about a 5 degree angle. All right, Skip, you're gonna feel a little tiny poke here.
Boy, you're really good. I didn't even feel that at all.
And then we're gonna inject. And then we're gonna pull out. And then should just have a nice little raised wheel on it, okay? And we're gonna throw our used needle into a sharps container, okay? And then we're gonna clean up. Skip, that wasn't so bad, was it?
You're the greatest, Chair Bear.
So now we're gonna blot off any blood with some gauze, and we're gonna take a marker, and we're gonna draw a 1-inch circle around the site so that we know where it is when he comes back in 48 hours. So Skip, you gotta come back in 2 days, okay?
Yes, I will come back.
Now that we've given that, we're gonna go back and we're gonna document, because that's the 6th part of our 6 rights is documenting. So we're gonna go back and we're gonna put that in the MAR, and that is an intradermal injection. Thank you. Nurse Chair Bear here.